It's me, Praveen Devkota, a third year MBBS student. Today, I want to discuss one of the important non-communicable disease, the commonly found among everyone. It's diabetes. Uh, in this video, we are going to discuss few topics about the diabetes, which includes the definitions, the types of the diabetes, the symptoms, and the test to be performed, and the medications and the complications that must not be neglected. At first, discuss the definition of the diabetes. What is diabetes? Diabetes mellitus. Diabetes means the diabetes mellitus, which is a chronic metabolic disorder that is mainly characterized by high blood sugar level, which means hyperglycemia, that mainly result from the body to inability to properly produce or utilize the insulin. It means that the rising blood sugar level is mainly decreased by the hormone insulin. If the insulin can't work properly or the insulin is not sufficiently produced, then it causes the blood sugar level to rise extremely, which mainly causes the diabetes. And then the diabetes is further classified into mainly the three subgroup: type 1, type 2, and type 3. Type 1 means autoimmune diabetes. Here, the autoantibody produced inside our body against some antigen causes the destruction of the pancreatic beta cells, which is mainly responsible for insulin production. When the insulin cannot be produced in sufficient amount or there is no production of the insulin, then it causes the blood sugar level to rise sharply. That causes the type 1 diabetes. Then type 2 diabetes. Here, the pancreatic beta cells, which produces the insulin, are working very good, but the receptor in the cells which respond to the insulin are not working properly. So here there occur the resistance of the insulin enough. Even the insulin is produced enough, but it can't can't perform its actions. So here it causes also sharp rise in blood sugar level that manifests at type 2 diabetes. And last one, but not the least, is gestational diabetes. Here, it is mainly in the pregnancy period. Gestational means the pregnancy duration. It is mainly during the pregnancy period, which is mainly due to the hormones that are produced extremely during the pregnancy. And then let's discuss some of the symptoms of the diabetes. Here, the diabetes symptoms include the three main symptoms that include the polydipsia. The patient feels extremely thirsty and he eagerly wants to drink the water. And polyuria, the patient urges to urinate in a frequent interval of time. And the polyphagia, the patient feels extremely hunger. And along with this, he also experiences unexplained weight loss, fatigue, and blurring of vision. Next, the test that must be performed in a individual can perform himself or herself the blood glucose test, sugar level test through gluconometer. It's very easy to perform, and in lab, uh, we can give the blood sample from where we can get the random blood sugar, the postprandial glucose, the fasting blood sugar, and the HbA1c. The HbA1c test is found to be efficient among these all, and whereas the random blood sugar is also one of the effective tests. But the easiest method is the glucometer, which is shown in the picture right side. It is the self-perform test. Here I have a small clip about how to perform a glucometer test. Let's watch this video. The pricking device, when prick on the palm of the finger, the droplet of the blood is just when touches the strip of the glucometer, then it record the blood sugar level on its screen. And in the ending point, the medications. Here we can, if the blood sugar level is not controlled by the oral medications, we can go for the injectable medications, that is insulin. At first, the oral medication is prescribed. And last, the complication. If the diabetes is not controlled in time and the timely action can't be taken, then it may affect a several organ, multi-organ can be affected. For example, it may affect the brain, causing stroke, heart causing the cardiovascular diseases, and the kidney causing the nephropathy. whereas the nerve causing the diabetic neuropathy, in eye causing the retinopathy, cataract, and glaucoma, whereas they also affect the periodontal, means the around the teeth, whereas the peripheral vessels and also the foot, which may cause the diabetic foot ulcer. And how can we prevent it? At last, we can prevent it by performing the regular physical activity, by having a balanced diet, nutritious food, having the less caloric diet, and we can also focus on weight loss. So, by this way, we can prevent the occurrence of diabetes. Although it is a genetic disease, but the risks can be decreased by performing these following activities.